Hi, welcome to Trinity Integrated Health and Wellness Center. Dr. John. Today we're going to be talking about heel spurs and plantar fasciitis. This is going to be a four-part series, so we'll go over everything from what we're looking at when we look at x-rays to what kind of treatments, what kind of shoes to wear, what kind of rehab to do. And so let's begin today with what is plantar fasciitis. So basically we have a set of x-rays up here that shows a heel spur right here. Now, a lot of times, anytime you have any kind of bone spurs that form anywhere in the spine, it's due to stress on the ligaments and tendons and also the joints themselves. And the most common place in the foot, of course, is right on the calcaneus or the heel bone. And anytime you see something like this, it should not be that big. It shouldn't be anything at all, actually. You have a what's called fascia that comes right through here. Fascia is just like a fibrous coating that helps keep your arch in your foot. And anytime you start weakening in the muscles of the foot, it starts pulling on that arch and dropping your arch down. Also, overpronation of the feet can cause it. Wearing a shoe that's too small, which we'll talk about at another time, all that can cause it. You also have, anytime you have your Achilles tendon that comes down, hooks in, and anytime you're having a lot of muscle tightness and pressure in the calf muscle, it can also pull back on this heel, causing a stretch on this plantar fascia and giving you eventually a heel spur. They're very painful. Most of the patients will tell you that when they wake up in the morning, they can't stand to put their foot on the ground because of the amount of pain that it causes. Usually as they kind of stretch and loosen up, it'll lighten up a little bit, but most people will tell you it's almost like having a nail driven into the heel of your foot. If you've ever experienced, you know exactly what I'm talking about and how painful it is. So as chiropractors, we're going to come in and shoot x-rays on this. We're going to diagnose this through x-ray and also through palpation, seeing what's happening with the arch. We'll watch you walk, see if you're overpronating or over-supinating. We'll also take a look at the shoes and the wear patterns on the shoes. So a lot of this is kind of like if you're driving a vehicle and your wheels are misaligned, it's going to put an abnormal wear pattern on your tires. Or if your feet are misaligned, it's going to put an abnormal wear pattern on your shoes, causing a lot of this. So again, heel spurs causing plantar fasciitis, extremely painful, something that you want to get taken care of. And if you can get the pain relief off, then you can actually walk on a hardwood flooring or a tile flooring without shoes. But until that point in time, you're going to be walking on your tiptoes, not letting that heel hit. So please come in and let us take a look at it for you. I think you'll find that there's a lot of good that chiropractic can do for you, as well as part of it is adjusting. And also the other part of it is doing therapies to help break up some of this and get more mobility back in your foot and then strengthen it. So come see us at 318-352-0099. Thank you.